Food and Drink Monday, presented by Papa Murphy's, home of $10 Tuesdays.
Welcome back. We are talking to Dr. Philip Lloyd today about stem cell therapy from Bellevue International. Thank you for coming on.
I'm glad to be here.
This is very interesting. Okay, tell us about stem cell therapy and how it works and how it can help us.
Well, stem cell therapy, we all have stem cells. When we're young, we have like 1 in 10,000 cells is an adult stem cell. When we turn about 50, it's 1 in 400,000 stem cells. A cell is a stem cell. Stem cells are what help our bodies heal.
Okay.
If you cut, bruise, injure yourself, the first thing that will happen, platelets will arrive and coagulate the blood.
Okay.
But platelets' main call in life is to actually call your stem cells from your bone marrow and your adipose tissue to wherever that effect is at.
Okay.
So one of the things we do with stem cells, we draw blood from you and harvest your platelets.
Right.
Then we combine them with stem cells. We get stem cells from 2 different places. One, we can get them from your bone marrow by drawing them out of your ileum, your hip.
Right.
Or we can get them from exogenous sources, what we call allograft sources, from full-term cesarean section donated placentas.
Right.
Not from fetuses.
Right.
We get those questions all the time.
Exactly, because people don't like that idea. But this is from me, if I were to come in, and then some full placentas, that babies that were born. Okay.
So when we age, we have fewer and fewer stem cells. So if you're below 50, we typically recommend we can get them from your bone marrow. After 50, the pool has less fish.
Right.
So we use exogenous sources.
What are some places that people, you see the problems the most in people?
Right. If you think about the #1 problem with disability, we think about heart disease, cancer, diabetes. The thing that's most likely to disable you in the United States is osteoarthritis.
Okay.
And that's one of 2 areas. And I have the models here. As far as your spine, it's the little facet joints in the back. They degenerate, and you lose the ability to stand. You compress those facets 10, 15 minutes. And if you can't walk 10 to 15 minutes, you can't take 3 laps around Walmart, and you're disabled.
You are disabled.
And you have to have somebody has to take your laps for you. Or the next area is knees. And the same thing with the osteoarthritic change, you can't stand 10, 15 minutes and you become disabled. So a quarter of us will live a quarter to a third of our lives in disability because we cannot stand long enough to meet our basic needs.
So let me ask you, you take the stem cell, you spin it down, do you then inject it in those areas that are having problems?
We take your blood and we harvest platelet-rich plasma. Platelet-rich plasma, your platelets are what call your stem cells to them. And if we use your stem cells or we use exogenous stem cells, we add it with the platelet-rich plasma.
Right.
The platelet-rich plasma is kind of like a catalyst. It will cause a 14-fold increase in the number of those stem cells.
Okay.
And so you get a 14 times greater advantage. So there are facilities that do stem cells and they don't do platelet-rich plasma, which is not wise. And the thing what we do with our facility, not only do we stem cells, but if you have degenerated, we can brace you to take pressure off that. There's more care that needs to be done than just implant stem cells because you have a reason you degenerated, so you want to treat the reason. So if your car is out of alignment and you wore the tire, you don't just replace the tire, you replace the tire and you realign the front end.
This is really interesting, and I know you have a clinic coming up, so you can tell people more about it. Tell us about it when it is.
Yes, if they're interested and they want more detail and they want to just talk to me personally, we have a lunch and learn October 23rd at 11:30.
That's right.
We come in, we provide lunch, and we just talk. We have a lecture, and then they can ask questions.
You can find out more information. Thank you, Dr. Lloyd.
You're very welcome.
All right, we appreciate it. All right, coming up, Dr. James Martin. Doctor. I'll call you doctor. He's a doctor in the kitchen, all right. It's visiting the show today and cooking at Gilardi's. But first, Michelle has tonight's dinner recipe. Take a look at this.